Hey, this is Russ. Time for some patient updates. Yeah, and we have a new patient today too. So we've got 2 patient updates and a new patient. So let's start right up with the updates. And as usual, I'm just going to read these things off camera. It's a little bit easier that way and I don't miss any details. Okay, so here's what 4M from Canada says. He says, "Hey Russ, just giving you an update about my next knee surgery." Yeah, he was going in for a second one. "I seen my new specialist today and I am scheduled for surgery on February 16th. So obviously, since I'm doing this report in March, it's been a little bit of time now. Okay. Looking forward to having this done and to be pain-free. I will keep in touch with you during my journey with my next knee." Okay, so then he follows up with another email. It says, "Well, it's been a week since the surgery and the surgery went well. The only real problems that I am having now is that they put a bandage on that wrapped around my knee, which I never had before, and my quad muscles is very, very sore to the touch." Okay. "I also have a sore shin, and when I stand up, it feels like I'm going to get needles shot down my shin. My shin is a reddish color to it. Just thought I would send you an update." Okay. I wonder, and it's just me personally, I wonder if this muscles, the whole thing with the quads is because it's usually an MUA will give you quad muscle pain, but I wonder if they put a tourniquet on his leg. Okay, because I know that some of them put tourniquets on the leg. I don't know if all of them do, but I know I've read people said that they've had tourniquets and the tourniquet causes them to have problems with their quads because they have to tie it off. So anyways, if 4M sees this, maybe he can update us if he finds out if that's the real reason why all that happened. Okay. All right. So let's move on to our next update. And this is patient 12F from Michigan. She was fairly recent. She says, "Hi, Russ. I saw the video. Yay." Okay, good. Regarding the hyperextending of the knee, it was not a pleasant experience. My knee would collapse backwards unexpectedly every week, 7 or 8 steps. Okay. "It only happens occasionally now because my muscles are stronger and I'm aware that it can happen. There's not any non-surgical fix to fix the problem." All right, so she's kind of living with it. "Someone asked me on the video if I had residual pain and stiffness. Yes, I do. I still use oxycodone at night if the pain gets bad enough in my right knee. And although I have a hyperextending left knee, it's stiff and achy at times." Okay, yeah, my knees are stiff all the time too. So anyways, I asked her, I says, "Wow, you always will need to be mindful that you don't hyperextend. That's got to be a difficult thing." And she says, it's something that I've gotten used to. It does not happen frequently anymore. The physical therapist feels that I naturally was hyperextending prior to my knees getting so arthritic, okay, that I couldn't straighten them. He based this on the fact that my elbows naturally hyperextend. Okay, well, so she has hyperextending elbows, and they kind of figured that might be the reason for her hyperextending knees. Okay, so it's kind of part of her, I guess. "The doctor took this into consideration for the second surgery, and I had to work extension like everyone else this time." Okay, so good luck to her. Hope that fixes up and the hyperextension doesn't get to be too bad. Okay, I mean, some of us can't even get to extend. She's going beyond 0 degrees is basically what she's saying. Okay. All right, so let's get on to our newest patient, and that is patient 13M from the UK. All right. And he's given us a couple of photos, and I'll put that up in a moment here. Okay, so here's what he says. "I am a 55-year-old male from the UK. I had an Oxford compartmento PKR on January 2nd, 2021. Okay, so he had a partial knee replacement. The brief history, I have boxed for a large portion of my life." So he was a boxer. Okay. Well, I was a martial artist. So there's some common things there. I did a lot of kicking. Boxing, he doesn't do a lot of kicking. All right. So I know what my problems came from. All right. He says, "When I was 19, I broke my left femur. I was a passenger in a car crash and the femur was nailed. I had the nail removed when I was 21. I was informed by my surgeons that I would have joint issues later in life, and that they were correct. Okay. I'm not really sure what he means by nailed. Okay. And here's the problem we have. All right. There's different terminologies between American English and the UK English, right? So nailed, fixed. Does that mean fixed? I don't know. If you know, put a comment below, or maybe patient 13M can clarify what he means by nailed. All right. Anyways, he says, when I was 41, I had my left hip resurfaced. This was life-changing for me and has allowed me to continue to box and remain active. I will say that at this stage, I gave up jogging, running for CV, and used the elliptical versus climber, etc., as my CV to support my boxing. Now, again, I don't know what CV means. Maybe it's just me. I don't understand English. Okay, let us know what CV means. Okay. Because my leg was 12 millimeters shorter than my right leg, I have put load onto my right leg for the last 35 years, and that had created the issue with my right knee. I made appointments with 4 different knee specialists, and the advice was very confusing. It varied from live with it to let's do a total knee replacement. Well, that's quite extreme, okay, for both. I also investigated an osteotomy, but I could not find enough information or data to convince me that this was a good option. All right. So he says, I started to look at all options, and I thought maybe my right hip, which is not great, was pulling on my IT band and causing pain in my knee. So I made an appointment to see my hip surgeon, who, by the way, he is the co-inventor of the Birmingham hip and Birmingham knee. Okay. He looked at my right natural hip, and although not great, he felt it was a few more years left in it. He also was able to establish that my left resurfaced hip was in excellent condition. Okay, that's good. Also, I said to him, I don't know what to do at that point, and he rolled up his leg and showed me his knee that had been operated on with the Oxford PKR, and he gave me the surgeon's name and contact details. I met with the Oxford PKR surgeon, and we established through the x-rays and the MRI that I was bone on the medial side and a candidate for the PKR, and he urged caution because it is a big operation and a big decision. To be honest, I was starting to ask myself if I should consider living with the knee for a while longer, but my knee was constantly locking, and I could no longer box, and walking my dogs had become a challenge any further than 2 miles. Okay. I bit the bullet and had the surgery. My surgeon came to see me straight after surgery and said my knees was extremely angry and I had historic fracture in the knee, possibly from the car crash when I was 19. Who knows though? I am now 4 weeks on and my leg is straight, and I'm not entirely sure of my flexion, but it's not too far off from my natural knee. If it never gets any better, that's fine by me as long as it's good. Okay. So he doesn't know what his actual numbers are, but he's fine with where he's at. Although I had a PKR, I had to sign the form that if my surgeon thought that I needed a TKR, then that's what he would have done. Yeah, I think, they may think it's going to be a partial, and when they get in there, they may make the determination they have to do the whole thing. So yeah, I would agree that's probably something it's probably the best thing. I mean, they can't ask you when you're knocked out, right? So yeah, you've got to sign away that you're giving him the decision to go forward for all of it if he thinks he needs it. Okay. Although I had a PKR, okay, that we've read that. Okay. I suppose the point that I would like to make is do not let the surgeon dictate what they think you need. Do lots of research, because I found out that one of the surgeons I met with only offered TKRs, and that not only offered the PKR, but they did not tell me this. Hope this helps. Yeah, so he's saying check out your surgeons first. Don't let them dictate and tell you this is what you need to do, when maybe another surgeon will say you don't need the entire thing done, you need just a partial. So Anyways, that is patient 13M, and we wish him well too. He's got some issues beyond what I'm understanding, because it's probably my own poor understanding of English. So if he can clarify a couple of those words that I didn't understand, maybe that'll be easier for everybody. Anyways, I just wanted to give you guys this update and a new patient. We have another patient coming up a little later this week, which I will give you an update on for that person. And then we'll be caught up at that point. So again, if you would like to be part of this and let us all know how you're doing, all I need is some photos of your knee, okay? And then I don't need, all the personal details. I just need to know when you had your surgery, how you're doing now, what your flexion and extension is, if you know what that is, and give us updates every now and then so we know how you're doing, okay? The photos help out because it just makes it a more interesting video if you put that in there for us. And I just need to know basically age, your gender, and also your location. So if you're here in the States, just whatever state you're in, or if you're in the UK, tell me you're in the UK, or if you're in Australia, wherever you happen to be, okay? One thing I wanted to know too, that if you need to send this to me, send it to me via email. And I also wanted to make clear that my email address is not russisright@gmail.com. It is contactrussisright@gmail.com. There's another person who has russisright@gmail.com. So if you send it to that person, he's going to start wondering why all these knee people are sending him pictures of their knees. Okay, so we've already determined that there's somebody else who has the basic russisright@gmail.com. That is not my email address, okay? And this is the reason I had to add it and make it longer, because somebody else already had that. So to get to me, you need to have this one long word that says contactrussisright@gmail.com, okay? You have to add that word contact within all that, all right? Don't forget. We don't want the other guy to be starting to wonder why he's getting all the pictures of people's knees, all right? Okay, anyways, if you like the video, hit the like button, hit the subscribe button, and I will talk to you guys next time.